And I still see I don't see presenter mode. Okay. Hello, everyone.
Good morning, or good afternoon, or good evening. As Dr. Armstrong very astutely pointed out, everyone's coming from all over the world. And we are very glad that you are joining us today at Residency Success. We will get started momentarily while we're still admitting a few people, and that's going to continue to happen, I believe. Let me see. Okay. And what I will do is, once we get started, we will introduce everybody, and then we'll leave time for questions at the end. And since Dr. Armstrong will also be introducing Dr. Watts, we will be mindful of her time because she is very, very busy. She's on call on a holiday weekend as well, so we'll let her go, and then we'll stay as a team to answer any further questions you have at the end of our presentation. So welcome, everybody. My name is Dr. Shae Datta. I'm the CEO of Residency Success. I'm also a brain trauma neurologist in New York. We also have Dr. Mia Armstrong, who's part of our team. She's a pediatrician. And we are welcoming Dr. Tabitha Watts today, and we're so excited to have her with us today. And we will get started shortly while we're still waiting for some people to join, maybe in about 3 minutes. Hope everyone is keeping safe this holiday weekend. For us, it's Memorial Day weekend here. And we are actually planning ahead this year because, as we know, residency match application is a very stressful process. Every year, something changes, rules change, as well as the direction from either ACME, AMA, or ECFMG changes every year. And if you are joining us, please mute yourself unless you unmute yourself to ask a question. That would be great so that we don't have any background disturbance. Right.
All right. Are we ready to get started, Dr. Datta?
Yes, let's get started.
All right. Hello, everyone. Again, as Dr. Datta said, my name is Dr. Mia Armstrong, and I am a pediatrician, and I have the honor and privilege of introducing you to a fellow pediatrician, Dr. Tabitha Watts, and she'll be presenting to us today. She is an experienced pediatric clinician, medical executive, and medical educator. She graduated from Case Western Reserve University School of Medicine and completed her pediatric residency at Cook County Hospital. After completing residency, she served patient families in her pediatric private practice, in correctional facilities, and on inpatient pediatric wards at various community hospitals and academic centers throughout Chicago and outlying suburbs. She has been a physician leader as medical director of an independent physician association and president of a physician hospital organization. Dr. Watts currently works as a pediatric emergency medicine physician in Chicago and a pediatric hospitalist in Delavan, Wisconsin. I hope I'm pronouncing that correctly. She remains passionate about medical education and its role in teaching medical providers to deliver high quality, compassionate care to our most vulnerable populations. She is active on residency recruitment committees, hospital quality committees, and hospital medical education committees. Dr. Watts has extensive experience in educating U.S. medical students as well as international medical students and postgraduates. She is dedicated to expanding the use of simulation-based teaching to enhance medical education, as well as being a vocal advocate for medical student and physician wellness. Everyone, please join me in welcoming Dr. Tabitha Watts.
Thank you. Thank you. I'm so happy to be here.
Yeah, happy to have you.
Yes, thank you, Dr. Watts, for joining us this morning. Obviously, you have a lot of experience in this whole process of residency application, match, all the little nuances. So we're just happy to have you kind of impart all of your wisdom on all of the students going through this year. And this is sort of a very nice graphic we always love to kind of refer to about how long it takes, right, for us to start applying. It's like our cycle is always like June to March. Can you speak a little bit to this timeline and what is the best time to get started? And for the people that, are at a specific point on the timeline, we'll talk more in detail going forward.
Oh, definitely. So, right. So when we look at, I love this graphic. It's awesome. uh, when we look at the graphic, right, we are going based on like the official NRMP FRIDA match, and of course the program and applicant match dates, right? So the tokens for applying and getting your initial like application number that's going to follow you and that you're going to use for the application process usually starts in June in any typically non-weird COVID time. But they've managed to kind of stay pretty close to that. So usually you get your tokens, or you can apply to get your tokens in June. And oftentimes people think of that as the start of the application process. What I like to tell my students and any candidates that I am speaking to is that that's the goal time for official application deadlines. However, you should consider starting your process as early as possible. As soon as you know that you want to, that you're going to be within the year of applying for the match, start working on your personal statement. We can definitely go into that a little bit more. But understanding that your application is starting with everything on your CV, right? So the timeline to actually apply starts in June, but in terms of you formulating and getting your thoughts and your route together as far as who you are as a candidate, that starts, that kind of predates even the application process. So definitely at the latest, start in June when everything opens up. But I like to really encourage people to start working on drafts of their personal statement even before that.
Right, absolutely. This is a lovely graphic, but I always say our year is March to March, correct? Because it's like the results come out. If you didn't match, or let's say you are going to match for the next year, March is the time to start. March to March, is our timeline really, because it's like less than 6 months and time just keeps flying. And we have so many challenges this year with the pandemic and everything else sort of on our plate. And I'll sort of ask you a little bit about, how medicine's changed during the pandemic as well, for us as well as the students. Would you mind sharing your experience about like medical education during the pandemic?
Oh yes, that has been a wonderful challenge. So of course, uh, medical education. I mean, all of us were very, very accustomed to, right? We're doing everything in person. We're going to be in person. So many of the students and postgrads that I've worked with are like, oh my gosh, I have to be in person. Well, when COVID hit, pretty much all outpatient services shut down. And really, the main things that were happening were, emergencies and COVID patients. And even the emergencies were relative in terms of what was considered an emergency because of just the overwhelming number of patients we had during COVID with COVID-like presentations. And so what happened at our institution is that we immediately, all medical students got removed from rotations. And there was a lot of focus on virtual training that happened. And even the AAMC had created a whole AMC collaboration for ways to educate your students virtually, in order to, try not to lose training time for the medical students. So it was quite a change. What it did was it definitely had us hone our skills for those of us who, of course, still had to stay in and actively practice. We honed our skills of an assessment with a little bit more limited information, right? Um, Early in COVID, we had phones in each patient's room if they were presenting with the type symptoms. Um, and we would try and get the bulk of our information from the patient or the caregiver who was in the room over the phone. And then we'd go in to do our physical as quickly and as efficiently as we possibly could, so as to decrease exposure to ourselves, even with full PPE. So educating our trainees, because the residents were still there, even though the medical students were not. So educating our trainees became very much, hey, again, what information do you have? How can you assess in that manner? And then, of course, all of our didactic sessions went to virtual, because we could not have the number of people in a room. So everything went virtual. Everyone, of course, previously you do slide-based presentations, but this was definitely, we're like, let's do slide-based presentations in order to teach. Let's also make sure that we'll use a lot more videos and examples for patients. So it was quite the change, and we're not really changing back to where we were. This is only going forward that there's going to be a hybrid combination from an instruction standpoint, in terms of telemedicine, and just overall, the ways that we are going to assess and obtain information from patients, to, of course, deliver quality care, but also to make sure that everyone stays safe. So it was, and it is still quite interesting. One of the just additional points that I wanted to bring up is relates to medical education and patient care, is that for our resident clinics, and because most of outpatient was shut down, everything immediately moved to telehealth based care. And for our resident clinics, everyone, we had this wonderful, on demand, face to face telemedicine based platform that was available to the residents and our patients. And a number of patients still preferred just being on the telephone, um, without any they preferred being on the telephone without any video. And so my residents were like, this is so difficult, this is such a difficult, transition over, because we're used to seeing patients, and we're like, you can use the video, and they're like, no, we just want to be on the telephone. So it's really really challenging us, as physicians, to be a lot more flexible, and to hone in on still our classic history, some physical, and our assessment skills, in order to deliver care to our patients.
No, I thank you for that very detailed narrative, because I feel that there are plus and minuses to the virtual platform, obviously. And so I wanted to kind of segue to asking you further, how do you feel, so for the international grad who's trying to get some type of hands-on, or let's say US clinical experience, they are being offered telerotations as well. So do you feel that that platform is sort of viewed the same or equal when someone or a program director is looking at their US clinical experience?
Yes, absolutely. So I was with a group of other physicians who were early adopters of the telerotation, and we continue to offer telerotations in pediatrics, general surgery, internal medicine, family medicine, and psychiatry and neurology. And it was very interesting, right? It was a learning experience for all of us. And so this past match year was our first year of having actual data as it relates to candidates who had telerotations and what that looked like for their matching success. So a number of candidates. So first of all, we'll start with from a recruitment standpoint, right? All of us know that we were in COVID. All of us were dealing with COVID. So early in COVID, so many candidates were like, "Oh my gosh, I don't know. I was supposed to be in person and it's telerotation, and I know need to know that I'm going to be assessed." And they were so concerned about that, being looked upon negatively. Um, our decision, because in one of the departments that I work very closely in, we typically have fourth years as part of the getting to know you phase of who wants to match. We typically allow fourth years to come and rotate, and it's kind of an audition interview that the month that they're rotating. And we said, not only are we not allowing that, anyone who's trying to do that, it's just not safe. So there were some aspects where it was looked upon negatively to have had an in-person rotation, definitely further away from where you would normally be. If you were in person in an area where you typically were, a local area, that wasn't a big deal. But if it's like, oh, if you're traveling during that time for a rotation, that's really putting, both your home as well as your visiting institution at risk. So the candidates that we spoke with that did telerotations interviewed and matched, they said they got a lot of questions about the telerotations from a very positive standpoint. People were very interested in, so what did this look like? What did this, what was your teaching? What did you learn? And how were your interactions? And it was very, very, very positive. So what we found and was able to conclude that there definitely was not any negative or reaction to doing a telerotation. In fact, those candidates were seen as being resourceful, right? They were seen as being determined and tenacious in finding ways to continue their education in what seemed to be an untenable situation to allow them that. In addition to that, especially international grads who were still in their own countries, oftentimes these telerotations were occurring at the time the physicians, would work typical, working daytime hours in the States, midnights and middle of the night and mornings in these other countries. And it showed the dedication that, hey, I am waking up at 2 a.m. in my country to 5 a.m. to stay on to get this education. And again, when we think about our traditional training as residents and as medical students, right, when we were in the hospitals doing our inpatient rotations, hey, we were up with the residents admitting patients at 1 a.m., 2 a.m., and we looked favorably on those students who were up with us at those times. So there was nothing but positive receptions for telerotations.
That is so incredible the way that you describe that, because this is what what we aim to do, is empower the student to highlight the best aspects of their experience, right?
Yes.
Because for whatever reason, we're as medical students, whether it's American or international, we're very hard on ourselves, right? We expect
Oh my.
ourselves, and everybody else expects the best from us, and kind of just sifting through your feelings and empowering yourself to highlight the best of the experiences you have had is sometimes challenging if you're not used to doing that, right? Because
Absolutely.
most countries have merit-based models of admission into training. So it's you pass an exam or you score in the top 15% and you're in. There's no like vetting process like we have here in terms of, okay, fine, it's the whole application. Tell me why these are the things that happened, or why do you have a gap, or why did you fail this exam? And then actually talk about it and tell me, like, share your viewpoints. And that's where we have a lot of trouble with these candidates, because they're not used to interviewing, or even these Zoom interviews are kind of impersonal at times. But I also feel that if you bring your personality forward, you still will have a very good shot at being able to communicate your background.
Absolutely, absolutely. I was just having that conversation with a few of my students who are rotating with me now, because it is often the question. It's one, especially for the virtual interview. It's, oh, how do I bring my best self forward? Really, as an applicant, the best thing you have is yourself. I know everyone hates hearing be yourself, but it is so true. Be yourself. Be your genuine self. I mean, you don't really fall into medicine no matter where you train, or, where you attend medical school. It requires purposeful thought, effort, and determination. And so you just need to bring that forward with whomever you are. So I totally agree. But yes, it is I recognize that it is definitely a shift when in certain areas everything is so scores, numbers, and merit based, and then it is difficult for candidates to say, hey, this is why I'm great. This has nothing to do with scores. This, of course, scores are a part, and I want everybody to be clear about that. That's definitely a part, but there is so much more, right? uh, they do need to distinguish themselves from maybe someone else who has the exact same scores as they do. What makes you different?
That's absolutely true. And this is basically what you need your mentors to help you with if you're unclear. That's why you need to also figure out who you are first. Just like you said, I loved what you said. When you start the process, you need to sit down with yourself. I am, and be honest, like, oh, I'm someone that does well on exams, but I can't really speak in front of people, or I'm bad at interviewing skills, right? So then you
Yes,
get the proper mentorship to bring yourself the extra mile. Because I think the emotional intelligence, a lot of times, is the last thing to come until someone actually fails at something and has to take a hard
yes,
why they failed. So what we're trying to do is help assist students to start early and kind of do some of that guidance with them. Obviously, the work is theirs, the guidance and advice is ours, right? So, and if you the earlier
absolutely.
you start, the less likely you will be scrambling starting June, because June is at that point you should be ready. Like if someone asks you for something,
Exactly.
problem. Here's my personal statement. It's all done. My CV's done. My, letters of recommendations are ready to go to be uploaded, So,
Exactly.
um, yeah,
Exactly.
right.
No,
So,
absolutely. I totally agree.
yeah. So, Dr. Watts, we wanted to ask you also, are research experiences valuable for a candidate, and how do you feel about that? And what research is actually something that you look for in a candidate?
Yes, so I get this question a lot, and what I probably the best way to answer this is yes, research experiences are valuable. I think that's probably the short answer. Probably the longer answer is, have I had plenty of international candidates match who did not have any research? Absolutely. Have I had plenty of international candidates who did not have research and had board scores just over passing match? Absolutely. So there is not one aspect of your application that is necessarily going to put you out or keep you in, right? However, the more check marks in a sense that you have definitely add to that. So, in no way would I ever say that research is not valuable. However, I would also say that of course, you could still match without research. The problem is, should you not match and you don't have research, then you're kind of like, well, is that the reason I didn't match? There's no way to really know what all went into that. We do look at you still as a whole candidate. So with that in mind, I would highly encourage everyone to pursue research opportunities. Now, when we talk about what that looks like on your application, so for those of you who have applied already, and for those of you who have not, there's a section on research, right? There's a section on oral presentations that is on the ERAS application. You can put research that has not yet been published. So a lot of people think that, oh, I have to put research that has been published. No, wherever it is in your stage, you can certainly put research that has not yet been published. Although, of course, it needs to be accurate. I don't want you making up, oh, I'm thinking about researching, methemoglobinemia in, pediatric patients with vaping. I just totally made that up. But so you should actually have some, some research that you've done that relates to that. Another thing that I bring up, because we do this on my rotation, is that all of the candidates are required to do a presentation to the group. It's a grand round style presentation. That is an oral presentation. That is to colleagues. That is to that you're presenting to attendings. So that is appropriate for putting in your oral presentations slot for your experience in terms of research experience. So just understand that yes, you do need research experience. However, or oral presentations for that slot, but it does not necessarily have to be published at that time. And to that point, and which is why I say definitely do not make it up, is that these are things that we ask about. Everything on your application is fair game for us to ask about, and everything in your application you should be able to speak to well and explain very well. So if I'm going to ask you, because you don't know who you're interviewing with, I mean, of course you can look them up and things like that, but you will interview with someone who is a researcher or someone who is like the specialist in methemoglobinemia. So you don't want to say something and make up something and not be able to speak to it. I'll actually give you an example. When I was a medical student, I had this really interesting patient that had Schnitzel-Gideon syndrome, which is you may have heard of it, Dr. Datta, just some super weird neurological, very rare disease where they just have these multiple seizures that are refractory to treatment, and they have a very poor prognosis. And so I brought that up, probably because I was like too nervous in my interview. I think someone asked me about an interesting patient, and I was like, "Oh, this patient with Smith-Gideon syndrome." And while I was able to speak to it from a very basic standpoint, I really felt that, oh my gosh, I probably should have, looked up a little bit more about this patient. Truly what the numbers were. I couldn't give exact, incidence of one in, however many births this occurs in. And so, I mean, of course, ultimately I matched, and that interview was not at the place that I matched at. I don't know if it mattered or it related at all, but it did matter in terms of my confidence and my overall, way to present myself for my subsequent interviews at that institution, and just my overall feeling about it. So when you're thinking about things that you need to speak to in your interviews and that are on your application, you need to be able to speak to them very easily, very well. So anything related to research, anything on your application, you need to be well versed in it. So please do not, make up, research or things that you didn't do.
Yeah, Dr. Watts, I feel like I want to have angels singing harps and just it's like such a aha moment, because this is the number one thing that I always say: honesty, integrity. You really need to have that come through as a candidate. You cannot make up things. You cannot lie, because you will get caught in that snare somewhere, somehow, because you are talking to seasoned people. And I'm sure at your institution, since you've been doing this for very long, longer than me, most likely, we are doing a lot more sort of psychological analysis of the candidates.
Absolutely.
Like obviously, like the behavioral interview skill things are that way. And even with Zoom, it's possible to do pod interviews where there's like 3, 4 people and you move to the next station and then the next station. I'm not
Yes.
sure. Yeah, people are doing like hybrid interviews like that. There's a lot going on in institutions to make sure we're picking the right candidates. Why? Because you are responsible for people's lives. You know, it's very, very
Exactly.
simple. It's not like a game that we're playing. It's not like we're trying to be unfair on purpose. It's not anything against you. Also, lots of sources of frustration, right? A lot of times candidates come from other countries and they underestimate the USMLE, right? Because they're just
Yes.
not used to being the top in their class at their medical school. But the way of testing is very different. It's not this integrative sort of multifactorial clinical scenarios. Multiple choice is not part of their application. So they go in thinking that like, yeah, I'll just do UWorld and go ahead without taking practice tests or, you know, working with someone who has been through the process. And then, you know, unfortunately, either they don't score as well as they want or they'll fail. And why is that important, Dr. Watts? Because as a program director, you want to make sure that they're going to pass the boards, right?
Absolutely. Absolutely.
Yeah.
Absolutely.
Because why it matters, because your ranking of the program is going to go down if you're graduating students that will fail the boards repeatedly.
Absolutely.
So
Absolutely. So that, I'm sorry.
yeah, go ahead. There's a method to the madness, right? I wanted to say so.
Definitely. And I'm sorry. It's like we're like speaking the same. We want to say the same things, right?
Right.
But yes. So sorry to interrupt, but that's the thing. And I realize a lot of candidates don't know this, but the way programs are judged is their first pass board rate, right? And that is the seniors, the people who have graduated that year, that they pass their specialty board that year of graduation. And if you don't have a 95% or higher, maybe 90% or higher board passage rate for your graduating seniors or specialty boards, that is looked negatively upon. And so that is what the programs are thinking about when they're thinking about the candidates that they are looking to bring in the program.
Absolutely. Absolutely. And I wanted to just clarify that because it was such a it's a lot to understand, and there's so many miscommunication and misinterpretation of all of the different things that are required. There is a reason why a personal statement is important. There's a reason why a CV, properly medically oriented CV without grammatical mistakes, is important, because you will be making patient notes um, or communicating with patients, and there's a very high risk of you getting sued if your communication is not up to par. You agree with that as well?
Absolutely, absolutely. And i- communication is so key, right? Um, when we think about this, and I think these kind of wrap into again the whole candidate. And even as we talked about telerotations, right? You are going as the trainee, you're going to be calling me, the attending at home, or calling the consultant at home, or calling the consultant in another department. You need to be able to effectively communicate to that consultant. You need to be able to effectively communicate to me regarding the patient, right? And I need to know that whatever you're telling me is accurate and honest. And I also need to know that if I say, oh, well, what did what was the neuro exam, or what was the musculoskeletal exam? And if you have not done that, I need to know that you're going to be the person to say, "Oh, Dr. Watts, I'm sorry, I didn't think about that. I did not do that. I will go and do that." And you'll probably be looking for these points. I will make sure that I do that, and I will call you back. Not that you will tell me, "Oh, it was negative. It was normal. There wasn't anything on there," just to kind of save face from not having done it. So no, we need to know that in the most difficult situations, your integrity and honesty will stand strong and stand true. And that is what we're looking for. That is what we're evaluating you for every step of the way of your application process. So to even kind of wrap back around to even when does this application, your timing, when does it start? Everything that you have done is as you start, or you're doing it as an applicant. We are looking at you as the applicant from everything that's listed on there. So just know that you're always an applicant.
No, absolutely. And we think highly of all our colleagues, right? I look at everyone, how far everybody's come and how much you have to sacrifice in order to do this. And I think it's so brave to want to come to a different country and integrate into that culture.
Yes.
And let's say, but that's also really key, right? You're coming from a different country and coming into the American culture. Let's say we do respect diversity, but we have a certain set of criteria that you have to meet for you to be able to practice here. And this is why we think that all of the documents are important to kind of give us sort of like a calling card. It's the face of your application, right? So that we kind of get an idea, this person Dr. Watts looks so interesting. I would really like to speak to her more during an interview.
Yes. Yes, absolutely.
Right. So,
Absolutely. And oh, sorry, go ahead.
go ahead.
Oh, I was just going to say, and oftentimes the candidates are coming from another country, and I think on some level they feel like, oh, well, I need someone to do me a favor in letting me into their program. And I want everyone to recognize that you have value, and it's not, oh, American medical grads only, that's all we want. No, you have value and you have a unique set of skills and additional information because you come from a different environment. But the key is you being able to communicate that and sell to the committees why your experience, how that adds to what you will bring as a candidate. If you have any doubt that that is true, you can look at the AAMC, because I was just recently at their GME conference, and there is a whole section on education of international medical grads. The AAP has a whole section on international medical, graduates. So you all are not sneaking in. You all are not trying to, get in and, oh my goodness, just please let me in. No, you are a valuable part of the healthcare system, but you are just probably a little bit less used to having to sell yourself from that standpoint. Those of us who grew up and trained in this country, we write personal statements for everything, right? We're writing them for college, for high school, for scholarships, we write personal statements all the time. Whereas you all are, it's oftentimes in certain areas it's a little bit more numbers based, right, and merit based and performance based. So I find that a lot of this is really recognizing who you are, what value you have to bring, and really communicating that.
Absolutely. And I think your words are like worth their weight in gold 10 times over because I think what happens is everyone thinks there's a shortcut or there's some, like when I sit down and, mentor somebody, they'll be like, oh, I heard there's like a shortcut if you go through the prison system or if you do this. I'm like, no, everyone needs to go through the same application process. There's no shortcut. You need at least 1 year of medical residency, intern year in order to practice medicine, period, in this country. There's no shortcut. You just
Exactly.
have to work. You have to bring yourself, and you have to, if you don't know how, then you need the proper mentorship to do that. So now let's move on a little bit to interview questions. This is sort of the deer in the headlights thing for a lot of medical graduates, especially international medical graduates, because they're not used to interviewing. Like you said, we write personal statements for everything, high school, right? If we're applying to a small job as a dog sitter, they might ask us for
Exactly.
it when we're like young. So we kind of just get used to, like, writing them and highlighting the best of us, as well as interviewing. It's very scary for a lot of people. And while we won't get into, like, this is just an example, I thought this was a really very interesting infographic, talking about some of the common medical residency interview questions. Tell me what is very important for you when you're interviewing a candidate. Just give me your top 3 things.
Oh, absolutely. Oh, wow. So top three, certainly their ability to converse and have a conversation in the interview, right? So I personally do not like to have to feel like I'm pulling teeth, right? Um, I like to think I'm a relatively personable person, and while I understand that there is a spectrum of, right, some people have a little bit more ease at talking than others, and that's fine. However, you are here to sell yourself to me, right? And so you should be trying to sell yourself to me. That does not mean, if you're not a normally, hand talking person like I am, that I need you to talk with your hands. No, be yourself. You be who you are, but you need to be selling yourself to me. And I should not have to um, ask questions to get you to go into a little bit more, whether it's depth or accurately illustrate an example of why you would be a great candidate for our program. So probably that's probably almost one, two, and three is not being able to communicate and converse well, right? Because I need to know that you will communicate and converse well to our patients. Also, then it's probably another thing is really just, of course, a lack of professionalism, right? You need to be a professional, no matter what the interviewer is doing, what they look like, how they're being, and legally, of course, no one should ask the illegal questions. No one should ask the inappropriate questions about marriage and pregnancy and things like that. But unfortunately, sometimes you still have humans on the other end. So even if the interviewer is less than professional, that is not a reason or an opportunity for you to be, right? Understanding that when you're interviewing, when you're evaluating a program, when you're applying, you are evaluating the program just like we're evaluating you. This is not a one-sided unidirectional relationship. This is bi-directional. No matter how bad you want it, you still need to evaluate whether or not this is going to be a good fit for you. Because if you're unhappy, we're unhappy. None of us want troubled and troublesome residents. And so it's just a bad match for everybody involved. So just also understand that it's important for you to really evaluate whether or not this program is a good fit for you. And so if you find that there's an interviewer who is not appropriate or is unprofessional, then that's some information you keep in your mind to make decisions about this program. But you always remain, the consummate professional.
Absolutely.
So I
I
guess it's
think,
like two.
yes. No, but I think you covered so much in there, that people are not able to understand that this is the final, like, if you're there and you've earned an interview, that means people are interested in getting to know you better. And this is your chance to communicate to them exactly what your um, future life goals are, as well as get to know them, like you said. So it's a bi-directional relationship, absolutely. And oftentimes culturally, it's very hard for them to make small talk or ask them questions. They don't know what's appropriate. And that's where we come in. We really help you. And I think people can say I'm a little bit of an interview tyrant, because
Wonderful.
it's tough.
Wonderful.
So I'm a very tough interviewer. Okay. So the thing
Awesome.
is, like, sometimes even when they were in person, I would be like, to the fellows that were interviewing our program, I'd be like, um, get up. And they're like, what? Let's go for a walk. So we would just go walking around the campus and I would interview them while they were walking. you know? So
Awesome.
it's like, yeah, so it's like, you know, walking interviews or, you know, I like the boring answers, like, you know, just the other thing is, Dr. Watts, like when you think that people are just memorizing answers, that also comes across as not genuine, you know, because as doctors, we're used to memorizing everything, right? We memorize answers, then we memorize like an approach to a treatment, or we memorize for USMLEs, we memorize for CS, but this is a different ballgame. You cannot memorize answers.
Absolutely.
Yeah.
Absolutely. Right.
Yeah. So this requires
Right.
a lot of practice, you know, in order for you to be good at this, and kind of like avoid pitfalls in interviews. Um, do not misrepresent yourself, like Dr. Watts said. I will 100% agree with that because there's so many ways to check up on you now. It's very easy. You know, it's very easy. And as program directors, a lot of times we will call each other, right? It's very easy just,
Absolutely.
hello, Dr. Watts, can you tell me a little bit about, you know, Mia Armstrong? What type of, you know, resident do you think she'll make, or whatever question that we have, right? Because it's a long road for you, it's a long road for us. We want to make sure it's easy for us to work with you, as well as you to put in your 100% for the time and energy that the program will put into you. So like, again, that's bi-directional as well.
Absolutely.
So I know there's a lot of questions popping up on the chat, but we had a few that were already submitted previously. I was wondering, Dr. Armstrong, if you could just leave this Q&A, and I'll check in the chat if there's more for Dr. Watts to answer these questions.
Sure. So I'll just make sure to read them so that you can hear them clearly, Dr. Watts. So it says IMGs are usually not supposed to have gaps in their CVs from graduation from when they apply to residency, but this particular candidate has a significant gap in their CV. Can you advise how they can best improve their application to make up for that gap? How can they show that they are a good candidate for residency? And then I'll just add in sort of a clarifying question. How do you explain any gap that you have?
Honestly, that's the short answer to that very last question. In terms of the whole gap, right? So gaps are not inherently bad. So let's just start there. Gaps are not inherently bad. We recognize that we are that we are interviewing humans, and that we're not interviewing robots, right? So humans have human experiences. And because you have human experiences, sometimes you don't, things don't go straight through. It's like a straight arrow, right? We would talk about those candidates in even medical school, if they're straight arrows versus crooked or bent arrows, right? And so so gaps themselves aren't inherently bad. Gaps without explanations are problematic. The problem with gaps that have no explanation is that unfortunately you are leaving that explanation of what happened during that time to our imagination, and you don't want to do that. I'm a very creative person. um, you do not want that gap to be left to the many things Dr. Watts could come up with as a reason for you being off the grid. So again, I like to tell candidates to be honest about what they were doing during that gap. Some people have gaps, and this is not just for IMGs, it's also for American grads, right? Some people have gaps because they were ill, their parents were ill, a loved one was ill, and they needed to take that time off to care. Some of them have gaps because they needed to work to pay to continue their medical studies. Some people have gaps because of whatever their own personal challenges are. So you need to explain that gap. But, if you were working because you needed to pay for your medical studies, then you say that. But anything in that you did during that time frame, you need to wrap it back around as to how that makes you a better doctor. It's going to make you a better candidate. It's going to make you a better trainee. Um, if I wish we could just wash away the less than optimal parts of what we were doing, but that's just not the case. So the best thing is to explain that, and this carries through. I was having this conversation with one of my colleagues. He's on the hospital credentialing committee. Same sort of thing. He's like, gaps and negative things that have happened, or changes are not necessarily bad. What's bad is your lack of explaining them. So the best way to improve your application for that gap is to, one, be honest about what were you doing during that gap, and then how did taking that time off and doing whatever you did, how did that shape and reshape your approach, your sense of self? What kind of skills did you get during that time that makes you an even better candidate for my program right now? That's probably the best approach. So you can't make things up. Now, if you did a couple of things, like I don't know if you took some time off to care for someone, and then you worked as, I don't know, as a dog sitter, or, a house sitter and a dog watcher, that's fine. Say that and why you did that, and how that makes you a better candidate. I had one person I was advising. They were like, well, it took me a long time to graduate medical school because I had to pay, and then I started working with a friend to help pay, and then we did all this cool stuff, and I didn't come back for, like 4 years. And I said, okay, that's fine. You can talk about that. If you feel like you spent that time really just hanging out, you can say, I thought I wanted to do medicine. I was immature at that time. This is what I've learned. This is how I've matured. And now this is who I am. Those are ways you can discuss that time frame. Probably the only bad gap is one where you are saying, hey, I took a year off to study. Well, you took a year off so that you can get 260, 80, whatever on the USMLE. Well, you're being compared to candidates who are constantly rotating and doing other things while maybe not getting 260 on the USMLE, but still getting, 220 while they're doing things. So that's probably the only gap that looks a little bit more negatively, where it's like, oh, you just took all that time to study so you could score great on this test. That's not as that's not necessarily something that we value.
Yes, thank you for your feedback on that. And I think the takeaway is that you just have to have an honest and genuine explanation. And there was a question about COVID-19 and not being able to receive the clinical experience that we would like during the pandemic. And the question was, how do you make up for this on your CV? I think you've touched on this, making the best of it as you can and doing telehealth rotations, as we know that is a good option. Would you add anything else? How do you explain not having the clinical experience you desire? And how can you add to this on your CV?
Right. So I mean, at this point, right, you're looking back. So whatever you did during that time is what you need to address. If it's in terms of going forward, I of course I highly recommend telerotations. And I just kind of wanted to address, just as Dr. Armstrong said, you're saying this clinical experience that you desire, which is very much looking at this from a candidate standpoint and not a recruiter standpoint. The clinical experience you desire, you want it to be in person. And that is not there. Don't get me wrong, there are definitely some programs who, are like, hey, we want, in-person clinical experience. So don't get me wrong about that. But also, you need to take advantage of clinical experience that is offered, research opportunities that you can do, research opportunities that you may need to kind of generate yourself, and then find an attending, also a telerotation, or rotation provider to sign on and evaluate and help you with the publishing process. A mentor that can certainly help you with that process. So that would be what I would suggest, definitely.
Thank you. And someone asks, if your scores are low, is there any chance to match into internal medicine with a good CV, or any particular specialty? If you have journal publications and research, as you mentioned, and I think you've touched on that. Any final thoughts about showing or making up for low scores?
So again, the whole candidate is important, right? The candidate as a whole. So you are more than your scores. So absolutely, you can still match into internal medicine, family medicine, pediatrics, with low scores. Yes, you can, even as an IMG. Exactly. Having a good CV, having publications or research is certainly going to be helpful. Being a recent graduate is certainly going to be helpful, and of course, having a stellar personal statement that really, when I'm reading it, makes me say, "Hey, I want to meet this person and get more information behind them." So you are more than your scores. Yes, definitely try to perform well. That is kind of one of the not easier humps, but a very objective hump for you to get over, hurdle for you to get over. But your scores are what they are. You can't really fix them once you've got them, right? So you're gonna have to make the best of what you have to work with. But absolutely, you can certainly match into IM even with low and lower scores.
All right. I'm multitasking like crazy here, trying to get to some of the questions, but let's proceed. Thank you, Dr. Watts. That is just so
Absolutely.
to give us, just the honest opinion. So much of this is sort of like that candidates feel like they're like in a, that programs are sitting in an ivory tower and they're somewhere outside in the moat, but like,
Exactly.
yeah, but we're on this, we're on your side, right? We want you to succeed, but if you don't know how to succeed, you should get the proper mentorship from, people you're rotating with, or programs such as ours or other residents that have matched. So make sure that you reach out and have a good support system during this time. Dr. Armstrong, let's go ahead with these two questions, and then we'll see if there's any straggling ones in the chat after this.
Okay, sounds good. So Dr. Watts, are program directors willing to overlook the lack of ECFMG certification if the candidate has excellent scores?
No, no, that is a very quick and easy, straightforward. You cannot um, join. You cannot, your application, your paperwork. None of that is going to be applicable, accurate, usable, if you're not ECFMG certified. There's not really a lot of ways of getting around that.
Okay. And then should an IMG apply for the match in the year that they're graduating or the preceding year? And this particular question came from a Pakistani IMG who says that they usually graduate around March and they get ECFMG certified in August. Even if they've cleared their step 1 and step 2, they get their degrees late. So if you are sort of off cycle like that, when would be the best time to apply for the match?
Right. So you are not going to be eligible because, right, if you graduate around March and the match is happening in March, you need to be prepared to start working July 1. And so it's really not an option to wait for your ECFMG certification in August, because clearly you're not going to be able to match or to start working around July 1. For most, and I'm pretty certain this is the case for most states. Sometimes I do recognize that I'm in Chicago and Illinois can be a little bit more of a stickler of a state. So I'm speaking from that standpoint. So, you know, if I give any incorrect information about other states, you know, forgive me. But you can't get a temporary Illinois license which is what you need to practice as a resident in your first year, without being ECFMG certified. No, that's not an option. You can't start working, and so you cannot. I don't, and that's certainly, thank you for that question, because it's something I can look into as far as the other states. So from the knowledge that I have, based on the rules that I'm most familiar with, you would need to wait until the match season where you are already ECFMG certified, or will definitely have ECFMG certification prior to, ideally prior to March or soon thereafter, so that we can guarantee that you'll be ready to start July 1. So you would likely be applying that following year.
Thank you so
Great.
much. Sorry, Dr. Armstrong, to cut you off. I think we're just like so happy that we're getting these questions answered from, like, you know, the source. Like, it's amazing. There are a few questions that I already answered in the chat, but I was hoping you could field a few more before we wrap up.
Yeah, sure.
Yeah, so Dr. Watts, somebody asked, what does a strong letter of recommendation mean?
Oh, this is what does it mean, or what does it need?
I think maybe one and the same. What type of letter do you consider strong when you're reading it?
Right. So so here are my thoughts. Let's just start with my thoughts regarding LORs, right? Because everybody is very heavy on LORs. You need a strong letter of recommendation. Yes, you do. You most absolutely need a strong letter of recommendation. And what that letter of recommendation says is that you are a great candidate. It speaks to your work ethic. It speaks to your dependability, your knowledge base. A strong letter of recommendation speaks to all of those things. However, pretty much everybody who's applying has a strong letter of recommendation. So I find that a lot of candidates put most of their stock and worth in the letter of recommendation. Letters of recommendations, of course, they're important and they are necessary and they should be strong. However, a strong letter of recommendation only helps you so much, right? Because everyone should have a strong letter of recommendation. So you're not standing out from the crowd because you have a strong letter of recommendation. That is a basic. You should have all of your recommendations should be strong. Now, of course, if you don't have a strong one, that certainly can hurt you, because we're like, hey, why does this person have this bad letter? You know, this isn't, yeah, that stands out more than anything. So while I understand that people are, you know, oh my gosh, you know, I need to get a letter from this university with this letterhead in order to get in, that it's not as helpful as you think, but it is necessary. And I know that's really difficult, right? And just, you know, I'm not supposed to be monitoring the chat, but it kind of goes with it. Someone's asking about being able to see the LORs. We prefer that they are waived, that you do not see them, right? Because we need to know that the letter writer is being as frank and as honest and as upfront as they want to be. And so the LORs strong LORs are super important, because everybody's going to have them. If you don't have a strong LOR, that can hurt you. If you do have a strong LOR, great, you're on the same, you know, platform as not as everyone else, but as everyone else. So that's kind of a basic requirement.
Yes, very well said. There are few sort of code words. The funny thing is my fellowship program director kind of taught me this, that there are some lines that people use in letter of recommendations that can have dual meaning, you know, where we
Sorry, the
look at
toddler
it,
who's entered the room.
no problem. We hope that, you know, we won't keep you too much longer. So yeah, so there's letter recommendations can definitely help you or hurt you. And if you waive them, make sure that you're asking someone that knows you well, right? If you haven't put in your absolute best to that rotation and you ask somebody for a LOR, and I love to say that if you were in a rotation and you were just a potato, meaning you showed up, you stood around, you didn't ask questions, you did not participate, you didn't help your fellow medical students or residents or the team with preparation daily or follow up, then that LOR is going to be very bland, right? Do you agree, Dr. Watts?
Absolutely, absolutely. So you really should, you always need to be showing up, and you always need to, you need to give the letter writer good things to say about you, right? You know, you're not, hey, give me a strong letter because I asked for it. No, you're asking for a strong letter because the presumption is that you were a strong candidate, you were a strong student, you were a strong performer on the rotation. So you're not asking for anything different than what you have demonstrated. You are just asking for the letter writer to confirm what what you think you did, hopefully, right? So if you're asking, may I have a strong letter of recommendation, in a sense you're also asking for confirmation that you had a strong performance, and hopefully the letter writer will be comfortable, which they should be, with communicating to you that yes, I am able to provide you with a strong letter because of your strong performance. If they seem less than enthusiastic about providing a strong letter of recommendation, then that's probably one you don't want, because that is not going to help your application. And of course, if they are very clear in saying, well, I would like to, but there are some concerns I have or some issues or things that came up, then you definitely need to be open to having that conversation with them to see if those are things that can be addressed and improved upon, to either result in getting a strong letter or making a decision about getting a letter from some other letter writer.
Yeah, absolutely. Thank you so much. Now, there's another question. Is there a difference in how a letter of recommendation is weighted in terms of inpatient versus outpatient setting?
It is not. It is not. So what I like to, the grim reality or the truth behind the whole inpatient or outpatient, in person, out, or remote letter. So there is, so so no, inpatient versus outpatient does not matter. It really is weight based in terms of content. And I'll give you an example. So a lot of international candidates often will have more opportunities to rotate in community settings than in university settings. And so, we recognize that there are a lot more opportunities that way, a lot more with private docs. However, we are still a very networked industry, right? And so I have gotten letters, of course, from letter. I've reviewed letters of recommendations for candidates who have uh, who had university letters and who had clinic letters. And what one of the candidates, it was one of my batchmates from residency who was doing private practice and wrote a letter. Sorry, and wrote a letter for a candidate. And I saw that and I was like, wow, this batchmate, he like never writes letters. So the fact that he wrote this letter for this candidate speaks volumes about the wordiness and the type of candidate this person is. So don't discount the outpatient, the private practice doc who's writing your letter of recommendation. I mean, of course, we do want them to be versed in writing letters, because like Dr. Datta said, yes, there are ways to write letters that are expressive, that are very strong or less strong, or just kind of adequate. But we have vast networks. These are people that we've worked with, that we've educated, and sorry. Oh no, you can have that. Yes, sorry. So these are people that, sorry,
That's
and
okay.
and we'll give them a call, right, and ask them about the candidate and their performance.
Right. Absolutely. And as you can see, Dr. Watts is juggling so much in addition to being on call. So there are a lot of questions that we will answer via email, the remaining ones, but what we will do is we'll stay on, we'll relieve Dr. Watts as she has gone over her committed time for us. And we really thank you, Dr. Watts, for joining us today. If you would like to just give some parting knowledge and then log off, we will stay, Dr. Armstrong and I, to answer any further questions and talk a little bit more about how we can expect to guide you if you need the guidance. But I feel overall this was such a fruitful hour for our candidates, and we really thank you, Dr. Watts.
My pleasure. No, this was, I really enjoyed speaking to candidates, and I am truly invested in their success. And so just yeah, I'm sorry. I would just say to everyone to really think about yourself as a candidate of what you have to offer, not your deficiencies, but how your deficiencies, or what you perceive as deficiencies, have helped shaped you, how it demonstrates your resilience and determination, and who you are in the face of challenges. Think about yourself and your applications from that standpoint. And then, of course, I just always, and Dr. Armstrong, you can certainly let them know about it. We do, our Dr. Armstrong attended our sim lab on Friday. It's a virtual simulation lab most Fridays, where we do virtual simulated patients, and we do go over things like soft skills, how to talk to patients, in ways they could, the candidates can improve those skill sets. So, of course, if anyone wants to get in touch with me, you all have my information.
Yes,
They can get it
yes.
from you
So
guys.
I'll actually get that from you and share it with the meeting attendees. That's, yeah. And the one thing I'd like to say is that we're always learning in medicine. It doesn't mean that if you're at a certain place that you're constantly learning, even when you're like 60, 70 years old in medicine and been practicing every day. So just keep yourself in that kind of mindset that you're just constantly learning and be open to it.
Absolutely, absolutely.
All
Yes.
right. Thank
And I just want to say also thank you so much for your time. We are getting lots of thanks and appreciation in the chat. Everyone has found your presentation, your information to be so valuable. So thanks again for joining us.
You are so welcome. Thanks for having me. I really appreciate you guys, and I'm looking forward to the next one.
All right. Take care.
Yes,
Try to
take
have a
care. You
good
too.
weekend.
I
Yes.
will. Thanks. Bye-bye.
Okay. Bye.
Bye.
All right. There are a lot of other questions here that we will try to address, Dr. Armstrong and I, if people are still here, and we'll talk a little bit about what Residency Success does. Many of you are already enrolled in our mentorship plans. As you can see, Dr. Watts and I and Dr. Armstrong, we're all on the same page because there's no magic. There really just is hard work, as well as, um, you know, having the right guidance so to make sure you don't fall into like traps, and make mistakes. Or if you've made mistakes, it's not time to kind of just rehash it. We just need to get over it and kind of soften the red flags that you might have. Okay. So we have two types of mentorship plan. One is the basic, and another one is the platinum plan, which kind of handholds you through the application process. So if you're interested, make sure that you message me directly, or you message client relations. I think there's a WhatsApp QR code that was put into the chat, and contact us so that we can get you enrolled. You haven't missed that many classes because we also have bi-weekly and monthly classes for the Platinum members to guide them through each and everything that you might have a doubt about. All the questions you guys answered here, our Platinum our Platinum mentors usually just get answered right away, whether it's directly from us in a private Telegram group or via these classes that we have, as well as one-on-one sort of application review and strategy, where we come up with a 6-month plan for you on how you actually have to approach this process, what type of research you need to do, when should you time your clinical rotations, making sure that your letters are really strong, and making sure all your applications are all done before the September deadline. So all you do is just upload and just wait for the interviews to roll in. Most of our candidates get interviewed the first day that they apply. So September, the bulk of the interviews come in September, October, because of how sharp their application looks. We are very sticklers about grammar and proper punctuation, and obviously telling the story from your lens. We expect you to do the work with our guidance. And let's go ahead, and there's a few other questions that we may have missed. And here's a QR code. You guys can just scan it on your phone or save it so that you can contact us directly in case you have more questions and are interested in any of our mentorship plans. So there was a question, what should an applicant do to make a program look at his application and get past the filter if he has a low score? So this is actually loaded a question. There's a lot of ways that we prepare you for this. So we try to help you start networking from now. Most people have started even earlier as our basic mentorship plans or our Platinum candidates, where we come up with a way for you to build your LinkedIn as well as Twitter profile to start connecting with programs as well as networking. And then we put into place step by step how you're going to write a very strong letter of intent and make connections and have them look at your application and pull you in from the outside in. So there's no magic. If there's a filter, you're going to be filtered out. But the way that you absolutely do it is either rotating there, making contacts, or have someone look at your application from a different lens after you already networked with them somehow. Okay, any advice for old graduates if a program has cut off? I believe I just answered that question. Okay, I answered this ECFMG certification question already. Which type of research is good, especially if you're doing it as a medical student? So one thing, Anika, if you're a medical student doing research, that's great. You're starting early. We really like the candidates who come to us when they're taking step 1 or step 2 or early on, right? People like, oh, I'll take step 3 and then I'll reach out to a mentorship company or a place to look over my program, like specifics or application documents. That's too late, guys. If you start at step 1, step 2, start as a medical student, we come up with like a plan for you at that time, give you homework, check in with you again in a few months, make sure you're on track so that you're not missing the mark. Because by that time, if you've already have red flags, you wasted years, you have attempts, and then at that time, I don't have a magic wand to let all of these red flags be automatically gone, correct? It's much easier for me to guide you when you're at the beginning of the process. I'm not saying that we don't do it at the end, but at the end, it's harder and it requires a lot more of a skilled mentorship, which is like our Platinum plan, as opposed to you doing just the basic. I recommend the basic plan for anyone who wants to get all of their ducks in a row, but wait for the interviews to roll in order to commit to the interview session part, which is fine. But our Platinum members get the priority in terms of our like slots when we are doing bootcamp sessions for interview prep. So just keep that in mind. All right, let's see. There's a question, OET exam is on August 7th. Would I be ECFMG certified to submit? Usually, yes, it's within a month. But the closer you wait till the deadline to put in your application, they might just announce, oh, ECFMG has a lag time due to a high volume. It'll be 2 months until certifications are due. So you, at that time, you'll be pulling your hair out. So please do not wait till the last minute, okay? Filter, we talked about. How can I get a research assistant position with absolutely zero experience in research? We IMGs don't have much of it. Can you please advise on this? So research assistant position, I'll tell you one thing. If there is an academic place, most likely they have need for a research assistant. Now, the big problem that we're having in academic institutions this year is because of COVID, there's been a lot of restrictions. But if they're somehow able to give you a position remotely, that's the one thing we help our candidates write a strong letter of intent. So whoever reads it is like, oh yeah, I can have this person help me remotely, right? Because a lot of people write letters of intent and all they do is praise the program and write nothing about themselves, about why they should be picked for that actual position, okay? So the answer is, yes, you can, but it all depends on how you market yourself once again, and this is why we're here to help you do that, all right? If a candidate applies for more than one specialty, how should the personal statement be looking like? I'm really not sure what you mean by this. If you apply for more than one specialty, you should have separate personal statements. So one should, and that should be a one size fits all. Even if it's family versus internal medicine, you should be having two separate personal statements to highlight your skills and tell your story. Okay, Evan, Dr. Evan, in regards to letters of recommendation, do residency programs look more favorably at letters of recommendation from the same state? Absolutely. I do think that weightage of letters of recommendations from a same state where I know the quality of the program that's in my backyard matters. It doesn't always mean that they will, you know, that, you know, obviously we know what a Mayo looks like, right? Or a Harvard looks like, or a smaller community program in my backyard that has a very strong training program looks like. But don't let that deter you. Try to, yes, geographically include letters from the same state. If you can't, it's not a big deal, okay? Yes, Dr. Watts, everyone's thanked her. Yes, she was really amazing. I heard that PDs don't like accepting applicants who apply to different specialties. For IMGs, I heard it's advisable to apply to various programs. What should an IMG say when asked during the interview if he applied to a different specialty? You know, I think what program directors don't like, and I know this because I'm on several interview committees and I've been on interview committees since I started my training, all right? Is that if you are someone who is undecided and has no idea and you're just putting a fishing rod, right? You're taking like this thing and you're just putting it out there, and you're someone who applied to internal medicine, then OB, then you applied to pediatrics, then psychiatry. We're like, what, do you have multiple personalities? Like, do you not know what you want to do? Also, your CV is going to look all over the place, right? Because you need to have, it's easier for us to sell you if you are doing internal medicine and family, those overlap, right? If you're doing overlapping specialty, neurology, psychiatry, that, like, a focused CV is much easier for you to talk on. And it's not that we care if you're applying to different specialties. We just want to make sure you're committed to your specialty. It's okay to have backup specialties, but you must have the letters, the letter of recommendations, as well as a focused personal statement in order for us to know that you're committed to that specialty. Okay. Another person, what are the chances of getting matched as an IM as a 10-plus-year-old IMG with low scores? You know, this is like, you expect me to have a crystal ball, and I just really honestly can't have that, and I'm not God either. But having said that, Dr. Armstrong and I are very proud that we've had a lot of candidates with this type of background match after taking the help of Residency Success because of our approach with them. Did it happen with everybody? No. But I think you just have a better chance when you have someone guiding you versus you just blindly doing something. And absolutely, if you've applied previous year, do not recycle the same personal statement, the same CVs, because you know what? I actually remember people's application when I download it every year. I don't know. I have this propensity to read a PS and I'll be like, I read this before. And then I look at the name, oh, they just recycled it from last year. Delete, right? So please don't do that. We expect you to not have a static CV, right? That you're doing something to improve yourself in the next year going forward, okay? Yes, we will actually thank Dr. Watts from your behalf. She's excellent. And, you know, we actually on our team have attendings. Obviously, I'm a neurology attending, as you may or may not know, in the New York area. Dr. Watts is in the Atlanta area. She's a pediatric attending, and we have multiple fellows and residents on our team who were in your shoes not that long ago and can help you from a place, you know, of genuine concern, you know, to kind of help you along in this process. All right, so there's another question. Please explain on how to secure a U.S. clinical experience with no contact at a place. I'm sorry, this is a very, very involved process, and I think you should direct message us at this client relations so that we could set up a 10-minute consultation to guide you further, which is, we do this for every candidate that contacts us. We kind of look at your background and we kind of help you and guide you as necessary. Yes, so there's another question. Will people have a US only step one score who have a step one score have an edge on people who will give step one with pass fail? You know, this is actually a very good question, and I've been in numerous meetings at my academic institution talking about this. It's going to be difficult initially for us to kind of lay the groundwork and level the playing field, as they say, but they will not have an edge. We are going to put less weight on step one scores and look at the entire application as a whole. But obviously, right, if I look at someone who has a 260 versus someone who's coming at a 200, I mean, the writing's on the wall, right, in terms of who I'll choose. What are your chances of getting matches in internal medicine as 10 plus? I think I already talked about this. Is it advisable to apply when you're still a student since it shows no gap, but the downfall is, we already addressed this. Are LORs on the hospital letterhead seen more favorably? You know, guys, I think Dr. Watts really did a good job of talking to this. We don't mind if it's a community program, but if the community program has like a hospital or even outpatient, they can really speak to you and they intimately know you. Obviously, if you've done an inpatient rotation, we will look at that letter a little more favorably, trying to see how you perform there. But there's no like absolute rule. Oh, hospital letterhead versus community versus outpatient. We do read the letters to look at the content first and then after that, okay? Michaela Simpson, can we have the contact for Friday simulation? I think Dr. Watts and I will discuss whether that is appropriate for you guys to have her contact for the simulations. If she's okay with that, I'm happy to send it to everybody, but you must make sure we have your email address as well as your phone number to further contact you in order for us to send you that information, okay? I really hope this was helpful for everybody, and virtually, I know it's very difficult to connect with everyone and answer questions in a logical fashion, but we try to do our best. And we also try to let you know that you're not alone. There are people on your side that, you know, understand where you are and how you feel, because we were there at one point. And I'll take any further questions anyone has. If you could unmute yourselves and ask. I have a little bit of Zoom fatigue from multitasking or WebEx fatigue. So please unmute yourself, introduce yourself, and ask me any further questions. I'll be hanging out. Direct message us if we can help you. Please do not wait till the last minute. We welcome you if you need help last minute as well, but if you want to maximize your chances of matching, do it well. Be ahead of the pack, give yourself an edge. Do not wait till the last minute, okay? Because it's very, very stressful for you. It's very stressful for us, because honestly, like, I feel like all of the people that I mentor are like my children. It's really weird. So I kind of like yell at you and also laugh and cry with you at the same time sometimes. And there will be times where I randomly call up our candidates that we're mentoring, and I'll be like, so did you do this? Or where are you? Or how are you doing right now? You know, and what where are you in the process? So people know, they contact me, they let me know there is something, you know, that they're struggling with, and we do our best to guide you. If we don't, as you can see, we have a strong network. We have PDs we can ask. Dr. Armstrong can go ask somebody else if we don't know the answer. I can go ask, you know, someone at my own institution. Yes, please unmute if you have a question.
Hi, Dr. Datta. This is Raven from India. So I have a small query from my side. So me and my girlfriend are applying for a couples match the next year. I have a 220 and she has 230 score, and we're applying for a different specialities in different. So how do you think we should proceed? Like, do my low score affect her application, or is it any way like that?
Yeah, that's actually a very good question. So Dr. Revat, I strongly encourage you to join our group. Dr. Khosla, if you could please put our link for our Residency Success match group in there. There's a video that I did during the match season, this past season, that talks about couples matching and the intricate details about it. So you can watch that video to get more guide about exactly how couples match works. But in terms of a couples match, so yes, you're kind of tied together, but one good thing about a couples match is if there's a stronger candidate with a better score, they can actually help that pull that other person in and tell the PD, hey, like, you know, I'm applying as a couple. Would you consider, you know, my girlfriend or my wife or my husband, as he's also very interested in the Chicago area or New York area for residency. So that can definitely help you, but you have to get the interview first. And when you get the interview, you need to kill it, okay? In order for them to be like, you know what, I really want Dr. Revath in my program, and we absolutely should call, excuse me, his girlfriend for an interview in IM, even if it's not the same, they'll call the PD and give them the courtesy interview. So I hope that answers your question. Anyone else? Don't be shy. Anyone else in the chat?
Can you guys hear me?
I think there was a question, but I can't hear you.
Sorry, can you hear me now?
Can you speak up a little bit, please?
Can you hear me now, sir?
Yes.
Okay, perfect. So I had a question about Canadians applying for the US program. So we have our NAT exam happening in September, and you can use it for ECFMC certification. But would it be better to, because our results don't come out until November, would it be better to just do another pathway instead of waiting for your results for NAT?
Yeah, I mean, the quick answer to all of this is really try to fulfill whichever pathway the fastest that you can instead of waiting, because I've always seen that at the last minute there always is some type of delay, or something crashes, or, you know, it's just, bottom line is please try and do it as soon as possible, instead of waiting, you know, to make it easier for yourself stress-wise.
Okay, thank you so much.
Sure, you're welcome. And please go ahead and, you know, reach out to us, direct message us. Is the WhatsApp link broken? Can someone test it and let me know? If that is the case, we need to find another way for you to reach out to us. Is the WhatsApp link broken, guys?
I think Rose updated it. Oh, it's saying that it's still broken.
Okay. So there's a phone number here. There's a phone number that we can put here, that you can WhatsApp directly, if you're, you know, no matter where you are. So let me actually give that to you. If there's any further questions, I'm happy to answer it before we go ahead and enjoy our Memorial Day weekend for a change. But guys, don't be so afraid. Don't feel that you are less than anyone else. You are very capable. We believe in you, but please don't go into this blindly without any guidance or support from professionals that have been through it. Obviously, I'm talking about us, but if you don't go with us, go with someone that you trust. Make sure you have the right mentorship, people that are just not trying to sell you something because of the short-term gains. For me, I'm a full-time attending. Everyone knows it's very difficult for me to do this for you guys, but I find it so rewarding that I continue to do it with the help of everybody else on my team. They're invaluable to me because they really help to guide you when, I'm not always available, but I'm always involved. I know what's going on with all of my candidates, and I just, I wish you all the best. Now, this is the phone number that I just put in here, which is the direct WhatsApp for Residency Success, 917-524-8067. You may direct WhatsApp me, or you can email residencysuccess2000@gmail.com. And Dr. Yenny is saying, thank you, Dr. Datta and Dr. Armstrong, for your guidance and support. Really appreciate it. You're very welcome. And thank you for our moderators today, Dr. Hunsica and Ms. Rose, for helping all our candidates. I think we will sign off now and take a deep breath and go about our, yes.
Well, Dr. Datta, there was one more person who wanted to unmute, I believe it was.
Okay, go ahead.
It was Juan Anton.
Yes, good afternoon, Dr. and Dr. Armstrong.
We're having trouble hearing you. You will need to speak up. We're having trouble hearing you.
I'm sorry, do you hear me better?
Yeah, a little better.
If the time that the scores are released to program directors score, would it state indication that my scores are still pending, or will my market be totally screened out in that unwarranted?
Dr. Datta, I don't know if you were able to hear the question. If not, maybe it would be easier if Juan, you could email us. Were you able to hear the full question, Dr. Datta? I couldn't hear it.
Yeah, I'm sorry, I can't hear it. Would you please enter it in the chat, Doctor, because you are really breaking up, sorry. And I'll wait for you to enter it in the chat. You can email us as well. So, yeah.
And while we wait for that last question, I just would like to thank everyone for participating. Of course, you have our various ways of reaching out to us, so we'll make sure to get the WhatsApp link corrected. But you also have the email address and our WhatsApp number as well. So please reach out to us. Definitely improve your chances by getting this mentorship as soon as possible. I cannot tell you how invaluable it is to start early. You definitely want to start early. Not only does that make sure you have time to complete all of your documents and double check and recheck and make sure that they're perfect, but that you also have time to practice for your interviews. And when you go into any situation prepared, you're just that much more comfortable and calm and relaxed when it's time for you to be your best. And so I think it's very important that you start as soon as possible.
Oh, yes, I absolutely agree.
Yeah.
It's a stressful process and it's just not easy. I'll say that I think the one thing I had going for me is that I was always really good at interviewing. So my written skills were strong. So I somehow helped myself in that way. And maybe some of the part that we don't really talk about is a little bit of luck. But not everyone is that fortunate. So make sure you give yourself the edge and fill in the gaps where you need to fill in. I think the chat is there now. Dr. Armstrong, would you read the
Yes.
question out? Thank you.
Yes, so I'll read the final question. This candidate is interested in pediatrics for this coming match cycle. And he says, in the event that his step 2 score cannot be reported by the time the data is released to the program directors, would it still be feasible to land an interview if he still is waiting on that score? Or is it not at all advisable for applicants in this predicament to apply?
It all depends if you apply, let's say you apply and then you update it like within a month, let's say. But if, let's say, the ERAS is opening and they're downloading applications in September and you're applying in like January, it's not worth it. If you do it by October, I think you still have a good chance. And if the step 2 score is strong, that's even better. You tell them, hey, I just wanted to make you aware my step 2 score is there. And I scored a 250 or 240, whatever it is. Okay, so we also, in addition to guiding you through the application process in every aspect of it, we also help you with OET as well as USMLE steps. And we don't just like tutor for individual things like cardiology or whatever. We do that, but we teach you how to answer questions when you're between 2 answers. It's like everybody always picks the wrong one, right? You are doing UWorld and you're like down to 2 answers and you're like click, and then you're like, oh, I picked the wrong one, right? So our tutor actually does tutoring for he used to write questions for Kaplan, and he helps you with this type of strategy. And usually people go up at least 10 points on their UWorld scores after working with us, okay? So please don't hesitate to reach out. I'm really happy you decided to spend this time with us, and we hope to be working with you in the future. Otherwise, good luck, and we'll see you on the interview trail.
Have a good day, everyone. Stay safe.
Yes, take care.
Thank you so much.
You're welcome.